FND, or functional neurological disorder, is a condition where patients experience neurological symptoms not explained by traditional medical models. These can include motor dysfunction, seizures not caused by epilepsy, sensory issues, and cognitive disturbances. Despite its prevalence, it's often misunderstood and misdiagnosed. In today's talk, we will talk about the fundamentals of FND, the neurobiological framework of FND, and we'll discuss clinical insights and future horizons. Functional neurological disorder symptoms are vast and varied. Patients may experience uncontrollable movements, paralysis, non-epileptic attacks, and sensory symptoms affecting their ability to live normal lives. These symptoms are real and debilitating, impacting not just physical capabilities, but emotional and psychological well-being. Patients may present with motor symptoms such as tremors, gait abnormalities, paralysis, and weakness, and these cannot be attributed to classical neurological diseases. They may also present with sensory disturbances like numbness and cognitive difficulties, or even cognitive symptoms including memory loss. Most of the symptoms in FND will change the life of the patient significantly. Historically, FND was termed hysteria or conventional disorder, and it was thought to be purely psychological. Over the centuries, though, understanding has evolved. Today, we recognize FND as a result of complex neurobiological processes where the brain's normal functioning is disrupted, causing physical symptoms. Despite these advantages, misconceptions persist, with FND often mistakenly considered as a made-up condition, leading to stigmatization and inadequate care. Of course, there are some diagnostic challenges. The overlap of FND symptoms with other disorders poses diagnostic challenges, necessitating a multidisciplinary approach for accurate identification, and of course, educating both healthcare professionals and the public is crucial in overcoming stigma, ensuring patients receive the appropriate diagnosis and the appropriate support. FND is a condition at the intersection of neurology, psychology, and psychiatry. While stress and psychological factors can definitely exacerbate or trigger symptoms, the root causes lie in the neurobiological processes of the brain. This distinction is crucial for proper diagnosis and treatment. The neurobiological model suggests that FND is posited to involve intricate abnormalities in neural networks rather than being linked to a singular brain structure anomaly. These networks encompass the orbitofrontal and anterior cingulate cortex and subcortical limbic structures, which may be triggered by stress and other factors. These activated areas are hypothesized to provide inputs to the inhibitory basal ganglia, thalamocortical circuits, leading to a reduction in conscious motor or sensory processing. Functional MRI data comparing FND patients and healthy controls have revealed differences in regional brain activity during recall of traumatic events, such as altered activation of the prefrontal cortex and hippocampus, with some studies showing a correlation between these brain activities and symptom severity. Aberrations in brain networks, including those encompassing the inferior parietal lobe and the temporoparietal junction, which are crucial in self-agency perception, have been observed. Hypersensitive amygdala responses to fear stimuli, coupled with abnormal self-focused attention, such as depersonalization, including injury or panic, may also produce sensations or movements that are perceived as involuntary symptoms due to an altered sense of self-control. So we understand that FND is a neurobiological disorder beyond psychology, is a condition linked to brain and body interaction and is caused by an interplay between the brain, the body, and psychological factors. Recent studies using MRI and other brain imaging techniques have shown differences in brain activity in FND patients. These findings underscore the disorder's neurobiological basis, showing that FND is not all in the mind, but rather all in the brain, with real measurable changes in brain function. FND is a condition presenting a unique interplay between the brain's emotional and attentional processes. Today, we'll talk about the neurobiological underpinnings that contribute to FND, highlighting the pivotal roles of the limbic system and the saliency network. The limbic system, often referred to as the emotional brain, is central to our experience of emotions and memory. In the context of FND, the limbic system's heightened response to stress or emotional triggers can lead to physical manifestation of symptoms. This response mechanism suggests that emotional processing is intricately linked to the neurological symptoms observed in FND patients. For instance, increased activity in the limbic regions has been associated with the onset of psychogenic non-epileptic seizures, which is the most common manifestation of FND. The saliency network, on the other hand, is equally important. It is a brain network responsible for detecting and responding to important stimuli. In individuals with FND, there is evidence to suggest that this network may malfunction, prioritizing non-threatening stimuli as highly significant. This misallocation of attention can contribute to the physical symptoms characteristic of FND. For example, an interactive saliency network might interpret a normal sensory signal as highly significant, leading to an exaggerated or inappropriate physical response. The interaction now between the limbic system and the saliency network is crucial in the development of the manifestation of FND symptoms. This connection highlights the role of emotional and cognitive processes in the physical expression of symptoms. Real-world case studies illustrate the neurobiological underpinnings of FND, showing how symptoms correlate with brain dysfunction. Recent clinical research has shed light onto the mechanisms of FND, offering hope for more targeted and effective treatments. Coming to the treatment and management of FND, this includes pharmacological interventions, such as antidepressants and other anxiety medication, which sometimes can help alleviate the symptoms but will not treat the condition. The treatment is mainly psychological, requires cognitive behavioral therapy and physical therapy. Analysis of historical data reveals trends in FND incidence and prevalence, reflecting changes in diagnostic practices and societal attitudes. The evolution of treatment outcomes over time highlights the progress made in managing FND and the impact of increasing neurobiological understanding. Patients with FND will present with diverse experiences and different narratives. Their stories provide a window into the varied experiences of living with FND, demonstrating the disorder's impact on the individual's lives. There is hope, though, through treatment success stories. Narratives of successful treatment outcomes offer hope and illustrate the benefits of recognizing FND as a neurobiological disorder. The most critical and first step towards an improvement is the understanding and the acceptance of the condition from the patients. What are the future research directions for functional neurological disorders? Future research will aim to bridge the knowledge gaps between different conditions and to develop innovative and personalized therapies. Concluding today's presentation, we can say that FND is a condition with neurobiological recognition, and we need to emphasize the importance of this condition acknowledged as a neurobiological disorder and not as a psychological disorder. Thank you.